Hello everyone, a very good afternoon to all of you. So today I'm going to talk about a very confusing topic, be it third years, final years, interns, postgraduates, sometimes even to the staffs. Okay. So today I'm going to talk about what is called as PPD and CAL. Okay. Periodontal probing depth and clinical attachment loss. Okay. See, to be specific, this CAL itself can be, it can be termed as clinical attachment level or clinical attachment loss. Okay, so clinical attachment level means when a patient comes to the clinic or to the department for the first time and you are probing the patient, the markings which you write, be it whatever the values, that is called as clinical attachment level, the initial visit of the patient first time to the clinic or the hospital. And if I do the treatment, later I do probing, that value becomes clinical attachment gain or clinical attachment loss. So when you use the term clinical attachment loss or clinical attachment gain, that is after the treatment. So actually speaking, when you write in your case sheet, the CAL, what you're writing is clinical attachment level. It is not clinical attachment loss or gain. Okay. So moving on, as we all know, cemento enamel junction is one of the constant structure or constant reference point in a tooth. Okay, it does not vary. If you look at buccally, this is the buccal view. Okay, so if you look at the buccal view of a tooth, the CJ is much more higher than the CJ which is located interproximally. Fine. So CJ, as I told you, is one of the constant reference point which is very important when we measure the probing depth or the clinical attachment level. Okay. Now, how to detect CJ? How to detect CJ? Very simple. I'm going to take a probe or an explorer. Okay. I'm going to run the probe or explorer in this direction towards the CJ, and when I reach the CJ, there's going to be a sudden drop. As you see, as you do an access opening, there's going to be a sudden drop when I run the probe from this direction towards the CJ, and there will be a sudden dip, right? That is how you detect CJ. So run a probe towards CJ and you feel a sudden drop. That is what is CJ. So if you look at the distance from the CJ to the gingival margin, it is approximately 1 to 3 mm. So am I right in saying that the gingival margin in a LT patient is always coronal to CJ, which means it's above the CJ. Fine. So let us assume that the LT patient will have gingival margin somewhere here. The LT patient will have gingival margin somewhere here. Am I right in saying that? Because it is usually coronal to CJ, approximately 1 to 3 mm. Fine. You have any doubts in this? Okay. Now, moving on, I'm going to detect or I'm going to probe in 3 different scenarios. Okay. First scenario, what I'm going to talk about is a patient comes to you, he or she is not having any kind of a bone loss or any kind of an attachment loss, which means he or she is healthy. Okay. And I'm going to do a probing depth in this patient. So let us assume, okay, just give you a overview of the normal structures which is present. Okay, so if you take a look at this image, this is gingival margin. Okay, this is gingival margin, and the space between the gingival margin and the tooth is called as the gingival sulcus or crevice, whatever you name it. So this is the area where my probe is going to enter. Okay, and the point where the probe hits will be approximately at the level of CEJ. Fine. So what is this dot 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 structures? These dot 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 structures, which is present immediately below the CEJ, or it, to be precise, it gives the attachment to the tooth. Okay, so the point where the gingiva becomes attached to the tooth, this is called as the junctional epithelium. Most of you would have heard of it, junctional epithelium. I'm not going to talk about in depth about what is junctional epithelium. Okay, we are just going to talk about PPD and CAD. Okay, so the structure, you see some kind of a fibers beneath the junctional epithelium, right? These are the gingival connective tissue fibers, and these blue structures, these blue fibers are periodontal ligament fibers, and this is the alveolar bone. Okay, this is the outer cortical plate, this is the inner cortical plate, and point where the outer and inner cortical plate meet is the alveolar crest. So these are all the basic anatomical structures of a tooth. So I just want you to get used. When I say, when I probe the tooth, it is at the level of CJ, or when I probe it is below the level of CJ, you should understand that the attachment which is usually present at the level of CJ or 1 to 2 mm coronal to CJ is gone down, or has gone down, or has gone up, or is at the level. Okay, so clinical attachment level is usually calculated at 3 levels. Okay, it is generally based on the level of gingival margin and the cemento-enamel junction. So I'm going to take only 2 points for the measurement of clinical attachment level. I'm going to see where my gingival margin is, and I'm going to see where the cemento-enamel junction is. Okay, so the first scenario is patient is having gingival margin coronal to CJ, but I'm having a pocket. So what is pocket? Pathological deepening of gingival sulcus if the probing depth is more than 3 mm. Say for example, I'm having a pocket of 5 mm. This is one scenario. The second scenario is gingival margin is at the level of CEJ. Third scenario is gingival margin is apical to the level of CEJ. What is the third one? Gingival margin apical to the level of CJ. What does that mean? This is a classical definition of gingival recession. Very good. Okay, so this is the normal case where the attachment is going to be at the level of CJ, and when I probe, the normal probing depth is 2 to 3 mm. Okay, so in this patient, I'm going to see only 2 to 3 mm of probing depth. The attachment is going to be at the level of CJ, gingival margin coronal to CJ. This is a normal patient, say for example a gingivitis patient. Never write in your case sheet the probing depth as 0 mm. So if you ask me, will anyone have a probing depth of 0 mm? Yes, germ-free animals, maybe the animals which we grow in the laboratory for any drug testing purposes. But other than that, we are never germ-free. You are not going to have a probing depth of 0 mm. Okay, 1 mm, yes, if the patient is having recession. Okay, I'll tell you how. Okay, but other than that, it's going to be 2 to 3 mm will be the normal probing depth. Fine. So this is the normal scenario. This is the normal scenario. So apart from this normal scenario, if the patient is having these three situations, gingival margin coronal to CEJ, pocket of anything 5 mm, 6 mm, 4 mm, 7 mm, and gingival margin is at the level of CEJ, and gingival margin coronal to CEJ. Okay, now I'm going to take this scenario, the first one. Okay, so a patient comes to you, you take proper history, you make the patient sit, and there is some kind of crestal bone loss, but the gingival margin is coronal to CEJ. Gingival margin is coronal to CEJ, but when I probe, there is pocket of 7 mm. This is the first scenario, right? So I've just drew the first scenario. Patient comes to you. Patient is having gingival margin coronal to CEJ. When I probe, the probing depth is 7 mm. How to measure clinical attachment level in this patient? Very simple. So what I'm going to do in these kind of patients, that is, the patient will not have recession, the patient will not have any kind of interproximal tissue loss, the patient will look healthy, but when I probe, the patient will have a probing depth or a pocket. So what I'm going to do is, I'm going to detect CEJ. Say for example, I'm going to take a probe, run through the tooth, and I'm going to detect the CEJ approximately at this level. I'm going to measure this distance from the gingival margin to the CEJ. So I'm going to measure the distance between the gingival margin to the CEJ, which is approximately 1 to 3 mm. Let us assume for this patient, the distance between the gingival margin to the CEJ is 3 mm. Okay, so the distance between the gingival margin to the CEJ is 3 mm, and this patient has a pocket or probing depth of 7 mm. So the cal for this patient is, I need only, see, I need only this area. I need only this area, because this is the attachment loss. Anything below the CEJ is attachment loss, and I don't want any value or information regarding this area, because this is gingival sulcus, this is a normal, right? So what I'm going to do is, I'm going to subtract the probing depth with the distance from the gingival margin to the CEJ. So 7 minus 3 mm, so my cal will be 4 mm. So this is for a patient comes to you with the gingival margin coronal to CEJ, and when I probe, there is going to be a pocket. Okay, this is the first scenario. Coming to the second scenario, this scenario, that is, a patient comes to your clinic or a hospital, okay, and you find that the patient is having the gingival margin at the level of CEJ, something like this. So the patient is having gingival margin at the level of CEJ. You take a look at this picture, it is coronal to CEJ, and you take a look at this picture, it is at the level of CEJ. What does this mean? Very simple. This means, okay, this means the patient is having disease. Is it obvious, right? Some kind of tissue loss, which should be present here, is affected or is damaged. So this patient is having the disease, but the gingival margin is at the level of CEJ. Okay, so when the gingival margin is at the level of CEJ, although there is tissue loss here, there I cannot find out the attachment loss, because the attachment starts as normal. The attachment looks to be normal. The attachment starts at the level of CEJ, despite the patient is having some kind of interproximal or interdental tissue loss. These kind of patients we are going to classify under hidden recession or progressing periodontitis. Okay, so what does this mean is very simple. Patient is having some kind of disease, patient is having some kind of tissue loss or bone loss, but we cannot assume or we cannot tell at what point it is going to stop. It keeps on progressing. It is like 5 people starting to a running race. We don't know who will come first. It is in a very similar situation. The disease has started, and I'm not sure when it is going to end, or it is going to progress rapidly. So at this point, what I am doing is I'm assuming PPD is equal to cal. Okay, so these kind of patients are hidden recession patients, progressing periodontitis patients having gingival margin at the level of CEJ, so the disease is progressing. So I'm going to assume these patients are going to have PPD is equal to cal. Say for example, this patient is having a probing depth of 3 mm, then my clinical attachment level is also going to be 3 mm. Okay, it's very simple, right? Straightforward. Now coming to this one, the last one, gingival margin apical to the level or apical to the level of CJ. As I told you, it is called as gingival recession. Very good. So gingival recession patients usually presents like this, right? So this is CJ, this is gingival margin. So I can see the gingival margin apical to the level of CJ. So in these patients, what I'm going to do is I'm going to measure the distance from the CEJ to the gingival margin. Let us assume it is 3 mm. And then what I'm going to do is I'm going to insert the probe and do a probing depth measurement. Say for example, these are the patients can have any amount of probing depth, 1, 2, 3, 4, anything, okay, but not 0. So let us assume the probing depth is 1 mm. So in these patients, see, if you look at the first scenario, I just need the value of the violet or this pink structure, this one, right? But here what I need is, in case of gingival recession, I need the value from here to the probing depth, isn't it? So what I'm going to do is very simple. I'm going to add the probing depth and the distance from the CJ to the gingival margin. Okay, so in these patients, let us assume the probing depth is 1 mm and the distance from the CJ to the gingival margin is 3 mm. So the clinical attachment level for these patients is 4 mm. So in a very simple term, for a patient with gingival margin coronal to CEJ, patient is having pocket, I'm going to subtract the distance from the gingival margin to the CEJ with the probing depth. For a patient who is having gingival margin at the level of CEJ, I'm assuming the patient is going to have, PPD is equal to cal, because I cannot find out or I cannot conclude that the disease has stopped or it is in a rapid progressing stage. So hidden recession patients or progressing periodontitis patients, these patients I'm going to assume PPD is equal to cal. The third scenario, gingival recession patients, where I'm going to measure the distance from the gingival margin to the CEJ, and then I'm going to add it with the probing depth. These are all the three scenarios where you're going to calculate PPD and cal. Fine. Okay. Now, this is a patient with bleeding on probing, and these patients will, if the patient is having, let us assume a probing depth of 6 mm, these patients will be the ideal candidate for the first category, that is this one. Okay, so patients with gingival margin coronal to CEJ. Okay, patients with gingival margin coronal to CEJ, this is category 1. So patients with gingival margin coronal to CEJ, there is no recession, but the patient is having a pocket depth of 6 mm. So exactly this scenario. So if this patient came to your clinic or the hospital and you're doing a probing depth 6 mm, but there is no recession, the gingival margin is coronal to CEJ, first category. I'm going to subtract it to the distance from the gingival margin to the CEJ. Okay, the second scenario, beautiful, right? The second scenario, as you can see here, what is this? Interproximal tissue loss. This is called as beautiful black triangle. So black triangle indicates that there is some kind of an interproximal or interdental tissue loss, as you can see 3.1 and 3.2 regionals. So this, as I told you, as I informed you, that interproximally the CJ is going to be a little bit more than your buccal, right? So considering that case, my interproximal CEJ will be somewhere here, right? So these patients are having gingival margin at the level of CJ. I can able to visualize some kind of tissue loss, but I cannot, find out how much is the attachment loss. So I'm going to assume PPD equal to cal in these kind of patients. So these patients are, high risk of developing an advanced stage of periodontitis. So at this stage, I'm considering these patients are hidden recession patients, PPD equal to cal, progressing periodontitis patients. Okay. The third scenario, this is the CJ. Okay, gingival recession patients, it's very obvious. So what I'm going to do is I'm going to measure the distance from the gingival margin to the CJ. Okay, and then the next step, what I'm going to do is I'm going to insert the probe into the sulcus. So what I'm going to do is I will measure, let us assume this is A, this is B. Okay, so what I'm going to do is I'm going to add A plus B, the distance from the CJ to the gingival margin plus the probing depth. I take a look at this tooth. Okay, this is CEJ. Okay, so I'm going to measure the distance from the CEJ to the gingival margin, and then I'm going to insert the probe. I'm going to do a probing depth measurement. I'm going to add these two values. This is for class or category 3 group, where the gingival margin will be apical to the level of CJ, and you are going to measure the clinical attachment level. Okay, so I hope this video is is in a much simplified format, and if you have any doubts regarding this, you can post it in the comment section. I'm very happy to help you out. So whenever you write a case sheet, you just know the basics of PPD cal, because PPD cal is very very important for a case sheet, especially for a periodontal examination chart. So be it the third year, final year, or intern, PG. Okay, it's very important. So if you understand the core basics, it will be very easy for you to identify or diagnose a patient with periodontal diseases. So thank you so much for watching the video. Have a great day. Meet you in the next video. Thank you.